Today we're going to be evaluating the shoulder girdle, the internal and external rotations by demonstrating by throwing an object. I would like you to please just pay close attention to the video or to the demonstration. That way you can be able to see the different movements of the joints and the muscles that may be included within that movement. So to begin, the shoulder girdle is depressed. The glenohumeral joint hyperextends, moving the humerus straight posteriorly. The shoulder girdle is elevated. Then when the arm becomes perpendicular to the body, the glenohumeral joint externally rotates. The AC and SC joints retract. The scapula adducts at the same time. Soon after that, the shoulder girdle anteriorly tilts. Then upon releasing the ball or object, the glenohumeral joint internally rotates. The AC and SC protract. Then the shoulder girdle tilts, then finally returns to anatomical position, or the position that you started in. Then the glenohumeral joint moves posteriorly in the sagittal plane to hyperextend. The acromioclavicular and sternoclavicular retract and protract in the sagittal and frontal plane. The glenohumeral joint moves in the frontal plane while externally rotating and internally rotating. So during the evaluation or the demonstration, I would like you to look and think about the muscles that might be the prime movers. So the prime movers for the following movements would be: in the downward rotation would be the rhomboids and pectoralis minor. For externally rotation, there would be an infraspinatus and teres minor. Once the hand is above the head to throw the object, the deltoid middle fiber elevates the arm and abducts the scapula. Then the upward rotation would be the serratus anterior, trapezius 2 and 4. Internal rotation would be subscapularis, teres major, latimus dorsi, anterior deltoid, and pectoralis major. Then for the nature of contraction for each of the major agonists would be in the following movements would be the downward rotation would be rhomboids and pectoralis minor, that would be concentric. Then the externally rotation, that would be infraspinatus and teres minor, that would be concentric as well. Once the hand is above the head, that would be the deltoid middle fiber elevates the arm, abducts the scapula, so that would be concentric. In the movement of the upward rotation, that would be the serratus anterior, trapezius 2 and 4, which would be concentric. When it's a downward rotation, it would be the rhomboids and the pectoralis minor doing the movements. And the externally rotation, that would be infraspinatus and teres minor. Once the hand is above the head, that would be the deltoid middle fiber elevates the arm and abducts the scapula. Then it would be the upward rotation, serratus anterior, trapezius 2 and 4. Internal rotation, scapularis, teres major, latimus dorsi, and anterior deltoid pectoralis major. Then in internal rotation, subscapularis, teres major, latimus dorsi, those would be concentric, and then eccentric as the hand lowers. And then the anterior deltoid pectoralis major, that would be eccentric as the hand lowers as well. So that would be our evaluation, and thank you.